Hello everyone, my name is Stuart Blackwood of Blackwood Vascular. I am a board certified vascular surgeon who is on a mission to provide free medical education to as many patients as I can before I retire. Before we begin, please remember everything that you're about to hear is medical opinion only, not medical advice. And if you're watching this on YouTube or social media, and if you have questions or need care, and you actually need treatment, you should see your own board-certified vascular surgeon or interventionalist or medical doctor. I wanted to do this video today to do a sort of a basic primer of arteries and veins in the legs. And the reason why is I'm going to be doing now a series of videos on veins. For the next year, I'll be doing as many vein-specific procedures as I can to educate vein patients who really don't have a lot of time with their physicians on vein care. So a patient shows up with something like this, which is a varicose vein in the right lower extremity, the right leg. These big bulging squiggly veins, what are they? What exactly are they? And why do I have this problem? And does it need to be treated? And how urgently does it need to be treated? All of this we will cover in the next upcoming year. And my goal is that if you are a patient out there and you have questions and you're not sure how to actually navigate your own healthcare, you can use my QR code link here to my YouTube channel and drop a comment under any video I make, and I will read the comments and I'll make a repeat video. But what's the benefit to me? First of all, I'm not trying to get referrals or any sort of additional fame or anything, but I do want to give back to society in some way. And I think when I think about my journey and all the people who helped me along the way, I have found it very limiting working in a hospital to be able to give back to people the way I truly think I should give back. And I find that as I meet people on the street, a lot of people think and say to me that, Stuart, you do a really good job of explaining things to me. But I really don't have the time to talk to every single human being, and I really don't have the time to give them the 1 hour, 2 hours that they all deserve. So I feel like making a free video series is the easiest way to get to as many people as possible. So this is my YouTube link, my little QR code here. If you scan this with your phone or have your family members scan this, you can get to my YouTube. If you have a question, you can email me directly at blackwoodvascular@gmail.com. And I can try to make a YouTube video for you, and I'll respond to your email. It'll be all free. I'll just respond back to your email with another YouTube video that you can watch. I put this video in here. Hopefully the algorithm sees it as clickbait, but essentially we're stripping a patient's veins here in the leg. And I'm not the one doing the procedure, but I will not say anything more about that. Essentially, it's a vein stripping procedure, and this is not what we're doing, but this is sort of a proof in the pudding that we still actually operate as surgeons and do vein stripping procedures when we need to, if the patient requires it or desires it for whatever reason, as opposed to doing a minimal invasive approach. So over the next few weeks, I'll be talking to you guys about sclerotherapy and varithena and all of these other fancy minimally invasive techniques. But don't forget that we still offer vein stripping and other basic operations, stab phlebectomies. And then this is all lower extremity leg disease for varicose veins and chronic venous insufficiency. But we also, as vascular surgeons and interventional radiologists, etc., we also still treat the inferior vena cava, the iliac veins, none of which are going to be shown in the next few videos, but people with May-Thurner syndrome, people with an IVC filter. I'm going to try to address all of that as the year proceeds. And if you guys have questions or you feel like I'm speaking too much in medical speak, let me know, and I will tone it down even further and try to simplify it. Obviously, I'm trying to do it in such a way that it is useful to everyone. So let's get into the anatomy of the lower extremity. So with that said, here we go. I'm going to use my handy dandy app here, put all the muscles back in of the lower extremity. And you can see this person has nice quadricep muscles. Ooh, look at that rectus femoris. But if you are coming to see me, you're probably not caring about that. You care more about the arteries and veins. And I'm going to put some skin in here so you can get an understanding of what the lower extremity looks like. This patient is a male and anatomic model. So the first thing I think we should know about is that in the lower extremity and in the body, if you're a patient, your body has arteries and veins. Arteries are going to be shown in red here, and veins are going to be shown in blue. Arteries carry the blood from the heart full of oxygen. Look at this little artery right here, towards any tissue areas that need to be fed. That's a genicular artery around the knee. There's about 9 or so different collateral genicular articles that wrap around the knee, and these are supplying blood to the little patella, which is this little bone, right? And the skin and the muscles and the nerves, etc. How do you get the blood back? You get it back through the veins. And the veins, such as this one, almost at some point the arteries, as they get smaller and smaller, if you see this, imagine right here at the tip of this artery, the very tip of that artery gets so delicate. But that's not really what's happening. What's really happening is that it's branching into multiple smaller and even smaller picture arteries, to the point where they can't even make this in this app because there's just so many arteries. And arteries becomes arterioles and then capillaries, etc. So with that said, you have to realize that the app itself, even this app which has so much detail, is still limited. So think of the arteries in the leg, and I'm going to remove now the muscle, if that's okay with you guys, just because. And I'm going to remove the urogenital system because that's distracting. I'm going to remove the lymphatics, which is just what the lymphatics are, a network which is way more extensive than the arteries and veins, and essentially carry the water in our body back to the main source, which is the heart. I like to think of the body as, if we know that the body is mostly water, how does that water move around? And it moves around mostly with these lymphatic channels. So I'm going to remove the nerves. And if you're coming in with pain in your legs, you can imagine sometimes it's not an artery problem, sometimes it's not a vein problem, sometimes it's not lymphedema and lymph problems from the little green ones. So let's just pretend that you don't have lymphedema or nerve issues like neuropathy or other issues that might be affecting the nerves. And we're really going to focus in now only taking out the muscles on the arteries and veins. I'm going to leave the bones in just because I think it gives you a roadmap of where we are, and I'll leave some of the connective tissue in. We could take out the connective tissue of the joints. If you look at the leg, right, here's your hip. You have deep veins, which are, and again, arteries, highways, bring fresh oxygenated blood from the heart going downward, going down the leg. Right, the heart is back up here, and it's pumping blood all the way down into the leg, and there are all these branch vessels. People who have artery disease are usually smokers. People are usually diabetics. These people are usually having pain with walking that improves when they rest. Cholesterol, hypertension, etc. We can talk about that as the lecture series continue. The veins are the return roads. These veins bring blood back up to your heart. And it's weird because they actually bring blood against gravity back towards the heart, which you would think to yourself, well, there's no heart in my foot, so how do we actually get that done? Bonus points to anybody who's not a doctor or a nurse or a healthcare provider who can text us and say, how does the blood return back to the heart? And if you're not sure, I'll be making a video about that down in the days to come. So you have two types of veins, and this is one of the key things I want patients to understand. If we were to put back in some of the muscle layers, you would see that some of these veins are running deep within the muscle layers of the leg. So some of these veins are actually deep, like this femoral vein, which is a massive vein in your thigh, and it's accepting blood from this vein called the great saphenous vein, which is a superficial vein. When you say superficial, these are smaller veins closer to the surface of your skin. So imagine you just made a cut right over a vein that you can see on your arm or leg, and then you could actually see the vein. Really? That's actually a superficial vein. If you made a deep cut and you got down to where your muscles were, through the first layer, what we call the fascia, beneath that initial fat layer, like let's say you cut into your thigh and you got through the first fatty layer, because you have skin, then you have some fat, and then you have a layer called a fascia. And if anybody's ever skinned an animal like a pig or a deer, or any hunters out there, any of the guys out there who are hunters who are reading this, you've actually removed the fascia multiple times. There's a word for it, backstrap and all that. That is where the fascia is laying. And if you're underneath that layer, now you're in the deep vein system. The deep vein systems, no surgeons, as I know, are doing varicose vein procedures in America currently for them. There are some people who do valve work and do valve reconstructions, but most of that work is still, in my opinion, to the most part, experimental. Hopefully in the future we'll develop some technologies that really work and are FDA approved and repair people's deep vein valves. But if you think about the fact that you have these two types of veins, you have superficial and deep veins, then you can see why if you had your veins treated by a doctor, it might not all mean that all of the disease might go away, because even if you treated this saphenous vein and then you turned around and you treated this other saphenous vein here, the small saphenous vein, which is the second big superficial vein, what we call an axial. Axial means like it runs along the axis. So the axis would be like from your foot up to your heart. So the axial vein is a superficial vein. In terms of axial superficial veins, right beneath the skin veins, you have the small saphenous, which runs on the outside of your foot at the back, and it stops around the knee area. And you have the great saphenous, the bigger saphenous, which is really just longer, and it starts at the inside aspect of your ankle. And I like to tell patients that the great saphenous vein runs essentially where, imagine you're wearing a pair of pants, men and women, that inseam that the tailor usually sews, that's pretty much where the great saphenous vein runs. And it runs all the way up till you get to the groin. And then when it gets up to the groin, it actually empties its blood, because remember, this blood is going back towards the heart. It's a vein. Veins carry blood back towards the heart. It's emptying its blood. Oh, how can I see this now? I want to try to get... Here's the great saphenous vein. Here is it here. And we're going to hide some muscle so that you can actually see it. I'm going to hide this bone. And I'm gonna get rid of the arteries too. It's very confusing with the arteries here. So we just have the great saphenous vein now. And if you see, it's actually going upward and connecting with this vein, which is the femoral vein, that deep vein, that really big vein. You can't really see it here, but this femoral vein is like 5 times as big as this saphenous vein, usually. The femoral vein is measuring 8 to 1.5 centimeters in diameter. And sometimes you have 2 of them, a paired vein system. This saphenous vein is much smaller in diameter. I'm not even going to pretend that I know all of them. So I'm going to look this up real quick so I can give you some better details of the leg veins. Because people are going to then say, well, Stuart, you're a vascular surgeon. You should know every single thing, right? You should just have it on immediately on play. But and the reality is, hopefully I will one day learn everything as I do these lecture series. So this will be a great way for me to study and stay ahead of the other surgeons and interventionalists across the country, because I'll be really studying to get these videos well for you over time. So a common femoral vein, as I said, 8 to 12 millimeters. I was perfect on that one. Superficial femoral vein, 6 to 8 millimeters. Popliteal vein, 5 to 7 millimeters in diameter. Tibial veins, like a posterior tibial or peroneal veins, that's when you get lower down in the leg. So the popliteal is this area here. Sorry, not there. That's our great saphenous. This area is the popliteal. You see how they shaded it? I'm going to turn the patient backwards. So if the patient was standing backwards, it would be the part of the femoral vein. The popliteal and the femoral vein are basically the same thing, right? It's just that the road changes names as it goes from one area to the next. So you can see it's the popliteal vein in this segment, and then right where it becomes dark blue, it becomes the femoral vein. And that's usually where it pierces the adductor hiatus, and which is a muscle tendon group, and goes from one part of the thigh to the other. So back to our little anatomy lesson here. The tibial veins, the smaller veins down here, and I know I'm all over the place, but hopefully this is helpful. There's usually when you get below the knee in the leg, as well as when you get below the elbow in the arm, you have what's called venae commitantes. You have two veins for every artery. So you'll have these two posterior tibial veins, and usually, if I put back in the artery is right between that. Look at that. Wow. And the same thing for the fibular veins, which is running next to the fibular bone. And if you put the arteries back in, there is a little red artery right there, the fibular artery. We also call it the peroneal artery. But all of these veins are bringing blood back towards the heart, and these are all deep veins. Any vein like this that has these vena commitantes, these double veins, are all deep veins. These are veins that if the valves are not working in them, you can't operate on them. You just have to wear compression and elevate your leg as much as possible. So the only way to treat this patient would be to, have them lay down. Have them lay down and lift up their legs. I don't know how to get this guy to lay down. It won't allow me. I wanted to flip him upside down. I was taught from my anatomy, and I'll have to check this as the year goes by, that the saphenous vein typically has 7. The great saphenous vein from ankle to the groin area has at least 7 valves, one-way valves. So you might have a little one-way valve right here, and I don't have a picture right now of one-way valves, but another one-way valve right there. And so what's happening is that as blood is pumped down the red blood vessels in this person down there to their foot, and is coming back up through the blue blood vessels, the veins, the valves actually open and close. As the blood is going up, it opens, and then as soon as the pressure from below ends, it tries to fall downward, but then it hits the valve, and the valve is a one-way valve, so it closes. And that is a lot of what I wanted to talk about today. So essentially what we would treat is the superficial veins and the deep veins. And oh my goodness, I am forgetting the very, very, very most important third part of the vein system today. And we're not going to talk about arteries that much, because I'm doing the vein lecture series first. But here is the third part. Let's see if I can find one. Right here. You have the small saphenous vein, and it's going to empty into the popliteal vein. You see that? Right behind the knee. Right there. Right? Let's hide this vein, hide this artery. So the small saphenous blood is coming up and emptying into the popliteal vein. And that's why when someone treats your small saphenous vein, your axial veins, because the small saphenous goes into the popliteal, which is a deep vein, and the great saphenous enters the femoral vein, which is a deep vein, you cannot treat too close to this junction here, this connection point. Because if you try to burn or laser the small saphenous vein or inject a sclerosant, you could damage the actual deep vein and cause a deep vein clot. And so we're very careful when we do our procedures to stay a few centimeters away as per the instructions for use that the different companies and instruments that we have give us. But then here we go now. The third and very most important thing is there are additional connection points between the superficial veins and the deep veins. And these veins are called perforator veins. Perforator or communicating veins. And so when I think about perforators, I think about a bridge between between the veins that are close to the skin and the veins that are deep inside the muscles. These veins pass through that layer, that sort of like sheet that wraps around the entire leg. And these perforator veins also have one-way valves, and the one-way valves in this case will be going right to left on this screen from the superficial to the deep vein. So sort of forcing the blood to go into the deep veins and into the deep system. When those valves fail for whatever reason, and we will talk about chronic venous insufficiency and everything else, and why the reasons why people's valves fail in later videos. But when those valves fail, you can imagine instead of the blood going from this way towards that deep vein over here through the perforator vein, instead of going into the deep veins, it now runs backwards and backs up in the superficial vein here, and then goes down the leg and just contributes to more and more swelling and pressure at the patient's ankle. What else can I tell you? If the veins bulge up too much, they can cause varicosities to form, and I don't know, what else can I tell you? There are a few different perforators in the legs, like the ones in the thigh called Dodd's perforator, D-O-D-D, connecting the saphenous vein to the femoral vein. There's Boyd's perforator near the knee, which links the superficial veins to the popliteal vein. And there's Cockett's perforators in the lower leg, which connects the great saphenous veins to the posterior tibial veins. You want your perforators to be healthy, and if they're not healthy and the valves start to fail and cause what we call reflux, whether in the axial veins or in the perforator veins or in the branch veins, accessory veins, etc., these would be causing increased pressure in the skin, and then all of those symptoms of heaviness, achiness, swelling, tenderness, itching, restless legs, etc. And so that's my anatomy / physiology of varicose veins and the anatomy of the leg veins. And I want to add two more quick things here, which should be pointed out. There are multiple along the way branch veins. So let's see if I can focus in on the great saphenous vein and just isolate this vein only. So along the way, as this vein runs from your ankle up to the groin, there are numerous branches that come off of this. These are perforating veins, which we talked about, which connect directly to the deep vein. But then there are also additional, just accessory veins. So if this was a riverbed, if this was a main river running from south to north, imagine that through the skin of the thigh and the calf and the foot, there are additional little branch veins that feed into this river. These are little tributaries. Just like how you have tributaries and streams that all run down to a main river that then runs to the ocean being the heart in this case. This is the same sort of anatomy that we have in the body. And so those accessory veins can become varicose as the pressure builds up inside of them, as the pressure builds up inside this main vein here. The other thing that I should talk about is the femoral vein, the iliac veins, which are deep in the pelvis. And even though you might not consider this part of your leg, this is still part of your leg, because this is where the leg blood flow is going up to. And then it goes even higher up to the common iliac, where the people with May Thurner can occur, where you have that compression of this artery compressing that vein between the spine and the hard, very powerful artery. And then finally the IVC, which is where we talk about its main blood flow. This is why women, when they're pregnant, have leg swelling at the eighth trimester, because the third trimester, because they have the eighth and ninth month, because they have a big baby compressing this main vein, and that increases the pressure downstream everywhere else. And so you can imagine your leg swelling, and you can imagine the amount of valve damage that happens if you've had 5 or 6 pregnancies. And then there's hormonal impacts and everything else. And we'll talk about that in later courses. But this is a lot of information for one day, and I hope that this was helpful. And I would want to tell everybody that right now today, you can start your vein treatment and your leg swelling treatment by just simply, let's see if we can get it to happen. Aha, right here. This is it. Just lay down flat. If you lay down flat on your bed, you are officially making the zero. There's no pressure when you're in that position. But when you're standing up, your height measured in centimeters is the amount of centimeters of water pressure that you're adding as an additional pressure to your ankle. So if you have leg swelling, your first step is always to lift up that leg, get it elevated above the heart, and the second step is to wear a compression garment. The third step after that is to go see a doctor. Hope this was helpful, guys. If you like the video, you can like and subscribe. If you don't want to like and subscribe, then don't do it. If you have questions, email me at blackwoodvascular@gmail.com. I'm happy to review people's charts, but within HIPAA rules. I really just want to give as much education as possible to our community, through the rest of my career. All right, good luck, guys, and don't feel disheartened by any of this. There's a lot to learn, but there's a lot of ways that you can treat yourself and get better. Thank you once again. I'm just going to end this off with my there I am, Blackwood Vascular, and here's my YouTube link if anyone wants to quickly log on or check me out. There you go.